Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Markham.
Program this evening. I'm glad you've stopped here. And if you happen to be channel surfing, just stay here for a few minutes because we're going to learn a lot about your teeth tonight. You know, we're going to smile a lot. We're going to have a lot of good times here. We have a specialist, Dr. Nick Van Zyl. He's given his time to answer your questions this evening. He's also a specialist on something called TMJ. We're going to talk about that. And if you want to get your questions answered, I want you to give us a call. Our phone number is 855-644-3278. You can give us a call. And I've learned so much about teeth already today, and I want to share some interesting statistics with you. Did you know that 75%, 3 out of 4 of the United States population suffers from some stage of periodontal gum disease? Those from you watching around the world, I don't know if it's the same there, but it's something that we have to think about. Now, here's something that I did know, and most of you know this, that people who tend to drink 3 or more glasses of soda pop, sodas, have 62% more tooth decay, fillings, and tooth loss than others. Another thing that I learned today is fluoridated toothpastes, when ingested habitually by kids, can lead to fluoride toxicity. I don't know what that is, but we're going to find out today because Dr. Nick is going to let us know what this. And here's a good one that everyone should know, that you are supposed to replace your toothbrush after you have an episode of flu, cold, or other viral infections because microbes can implant themselves on the toothbrush bristles, leading to reinfection. You don't want to keep getting the same bug over and over again if you don't have to. So we're going to answer your questions about tooth, teeth, gums, all that. Give us a call, 855-644-3278. You're watching Heart of Health Live. Stay with us. We'll talk to Dr. Van Zyl right after this short break.
The Heart of Health Live will return in just a moment.
The Heart of Health Live is brought to you by HeartWise Ministries.
Hello, I'm Dr. Tim Jennings with your Mental Health Minute. Whether you call it wacky tobacco, ganja, pot, or marijuana, the impact it has on your brain is not good. New research by Dr. Madeline Meyer from Duke University documents that adolescents who smoke marijuana before the age of 18 experience an 8-point drop in IQ scores that persist well into adulthood, and quitting did not fully restore intellectual functioning. This drop is significant as the average person has an IQ of 100, placing them at the 50th percentile for intelligence. A drop in 8 points would place the person at the 29th percentile for intelligence. This dramatically reduces one's ability to succeed later in life. Other research documents that those who smoke marijuana have higher rates of psychosis, and the risk increases with greater use. To be smart requires a healthy brain. So be smart. Say nope to the dope.
To learn more about mental health, visit comeandreason.com.
My life is full of statistics. Thing is, I could have dropped out of school and become one myself. But I didn't, because I had people that believed in me. Here's another statistic. 7,000 students drop out every school day. That's 1 every 26 seconds. It's time that students know that we believe in them.
Inspire a student and share your message of support at boostup.org.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Medicines That Kill from cardiologist Dr. James Markham is now available. In his newest book, Dr. Markham explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back, and if you just joined us, we're going to be talking about dental care, oral disease, all sorts of those things we're going to talk about. You can get your questions answered. Our call center is waiting to answer your calls. Give us a call, 855-644-3278, and you can be the first one to call this evening and get your question answered. We've got Dr. Nick Van Zyl with us, and Dr. Nick, thanks for joining us.
A pleasure to be here.
Now tell me, what got you interested in studying teeth and how to take care of the mouth and all that? How got you interested?
Since I was real small, I enjoyed working with my hands.
Okay.
And I was actually studying, well, I took my MCAT, wanted to go to medical school, and my brother was studying dentistry, and he said, Nick, he said, you need to be a dentist.
Okay.
He said, you'll enjoy it.
Okay.
And that was the short of it. I went to dental school. I didn't enjoy the first 2 years, the didactic, but when I started working with my hands in people's mouths and stuff, I knew I made the right choice.
And how long have you been practicing?
I've been practicing for 15 years in Chattanooga.
So you actually see patients every day?
I do.
Okay, you're a real dentist? Do you
I'm
hear
a
the
real
problems?
dentist.
Okay. Now, has anyone ever bit your finger or anything like that? That would always scare me, you know.
It hasn't happened, but close.
Okay, because I think, you know, kids would sometimes bite it. Well, well, we're answering people's questions, and I know you're a specialist and you really work on a lot of this condition called TMJ and how that relates to headache. Could you talk about that for a little bit?
Well, I'm a general dentist.
Yeah.
My focus, the things that I enjoy doing is TMJ work. I think I can make a big difference in people's lives. Not only TMJ, we're focused more on patients who've got extreme migraine headaches, cluster headaches, those kind of things. And we're able to really make a difference in those people's lives through some of the treatments that we use.
Well, tell me, what would you do?
Okay. I've got a fellowship in neuromuscular dentistry.
Okay.
Neuromuscular dentistry really addresses a triad of things: teeth, muscles, and the TMJ joint.
Okay.
Okay. And so all those pieces work together. In dental school, I think the focus is more just on teeth. Okay. But all three of those parts work together. And so most of the headaches and problems that patients develop comes from overworked musculature. Okay. And I think the dental profession as a whole ignores the muscles. Our lower jaw is only connected with muscles and tendons. And when we're sitting here, your teeth are not touching, but they're very close to touching.
Right.
Okay. You're not thinking about contracting this musculature that holds or postures your jaw in a position. That is done subconsciously for you through our central nervous system. And the determining factor of how much those muscles contract is related to the position of your teeth.
Wow.
Okay. So the majority of patients that we see, unfortunately, are patients who have had orthodontic treatment, and particularly patients who've had extractions in order to accomplish orthodontic treatment. I would say 80% of the patients we see are patients who've had extractions. And so what that means is when you start shifting and moving the position of the teeth, you are also changing the muscular relationship.
Okay.
And so some patients are able to adapt, but there's a great majority of patients who are not able to adapt, and that overworked musculature, all those muscles insert on the side of your head, that overworked musculature is a big cause of some of the headaches that we see.
Wow.
So basically what's involved when we treat these patients are relaxing that musculature.
Okay.
Now if I say, Jim, relax your your jaw muscles. You could maybe open your mouth, and there's a voluntary component to that musculature, but unfortunately, most of it is involuntary.
Okay.
And so we use a process called TENS. It stands for transcutaneous electrical neural stimulation.
Okay.
Physical therapists use something very similar in order to help patients with muscle spasms and things like that. Basically what we do is we force the muscles that hold the jaw, posture the jaw, to go to its most relaxed position.
Wow.
And once we get them in that position, we make a bite registration to show where the teeth are in space when the muscles are relaxed. We compare it to where the teeth are normally in space when they're not relaxed or in their habitual position. And the discrepancy between those two positions, we fabricate an appliance so that now when they close down, the muscles are in a relaxed position. And when we do that, we find headaches, neck pain, vertigo and dizziness issues, tingling of the fingers.
Yeah.
All those things can start disappearing if it's related to a malposition of the upper and lower jaw.
Well, that is so interesting.
Here's an example here's an example of a patient. And give you an example. If you look at her habitual position, if we put these models together, habitually her teeth would fit together like this.
Okay.
Okay. After tensing and relaxing the musculature, that's where her teeth wants to be. And that's a huge discrepancy.
Right.
So this patient had extreme migraines. And the reason for those migraines was 24 hours a day, her muscles, in order to posture her jaw, had to contract to hold her lower jaw in that position.
Wow.
Fabricating her appliance, something similar to this. And now when she closes down, those muscles that hold the jaw is in a more relaxed position. A couple days later, she's migraine-free, and she has been for 2-3 years now.
Wow.
So
that makes so much sense. You know, so many people have headaches and migraines.
Sure.
And, you know, unfortunately, a lot of people are on a lot of medicines, and that doesn't really treat the cause, does it?
That's right. It is the Band-Aid over a splinter.
So how would you tell for sure if their headaches were coming from this, or would you just sort of see if it helped? How would you tell for sure?
You know, the more I treat patients, I've been doing this for about 6 years, the more I believe that the majority of headaches is coming from a malalignment position. Sure, there's medical conditions, a brain tumor or an aneurysm, something like that.
Right.
And so what we'd like to do is eliminate all medical possibilities. The patient I really like to see in my office is somebody who has exhausted every avenue to try and get relief.
Right.
A lot of the patients that we see are patients who now the medication they're taking, their body has adapted to it. And now they've kept upping the dose and it doesn't have an effect anymore. And they're suffering extremely with these conditions. And so we're able to make a big difference in the quality of life of those patients.
Now, is there anything that predisposes people to having, you know, you've missed, you know, teeth out and braces, and any other thing that would predispose
I'm
them
not saying that braces is causing all
Okay.
this, but I'm just seeing that there's a pattern. There
Yes,
are
could be
patients,
having that,
it
right.
predisposes
Right.
somebody to have an issue. The big issue, there's a lot of patients who we treat who unfortunately just the developmental process can cause some of this. We are designed to breathe through our nose.
Yeah.
Okay? And so when we're born in a polluted world, our adenoids, the turbinates in our nose, our tonsils start swelling. When that happens, all of a sudden, instead of breathing through our nose, we start breathing through our mouth. When you breathe through your mouth, unfortunately, your tongue is not postured in the roof of your mouth anymore, but over your posterior teeth. And consequently, those teeth don't erupt into the position they should be.
Mm-hmm.
The tongue in the roof of the mouth forms the arch of the roof of your mouth, and if it's not in that position, the facial muscles will collapse the arch. So you develop somebody with a narrow vaulted arch and posterior molars that's not erupted into position. And there, in my opinion, 80% of the industrialized countries, we have malocclusions because of pollution.
Wow, that is so interesting. Well, I am learning so much today, and if you have headaches and your doctor hasn't discovered what it is, you might want to think about a possible etiology. We're going to come back to questions after this break. You're watching Heart of Health Live. Our phone number, 855-644-3278. If Give us a call. We're talking with Dr. Nick Van Zyl.
The Heart of Health Live will return in just a moment.
That is so interesting. I learned something about this myth.
I'd like to think that one day, when we get to heaven, we're going to see a list of people. People like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program, but we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
Medicines That Kill from cardiologist Dr. James Marcum is now available. In his newest book, Dr. Marcum explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. We are learning a lot about headaches and how that is a possibility. There are many other things that can cause headaches, but one possibility is that you have a misalignment. So I'm going to keep an eye on that. And if I have patients that have that, I'm going to say, I'm going to look real smart and say, you know, it could be related to misalignments. I got someone that can help you with that. That was very, very interesting. We have a call coming in. Alicia, you're on with Dr. Van Zyl. Go ahead with your question or comment.
Good afternoon. My name's Alicia, maybe from Virginia, and I'm interested in whether or not we need to have our metal fillings replaced because of future illnesses in our bodies as a result of having them in our teeth.
The American Dental Association says that dental amalgam is not hazardous.
Okay.
But in the same paragraph, they tell me, Dr. Van Zyl, you need a special biohazard company to remove dental amalgam from your office. So that doesn't compare. The only two legal places I can keep dental amalgam is in my office, is in a biohazard container and in my patient's mouths. Those two just don't correlate with me. So there are billions of people who have silver fillings in their teeth or dental amalgams. I think there are some patients who have depressed immune systems who that truly does have an effect. I think for the majority of patients, we are able to tolerate it. But I don't think it's the best filling material that's available to us today. Many years back, I believe that was what we had, and that worked well at that point in time. Excuse me, at that point in time. But today, we have materials that work much better than that. And so I wouldn't tell my patients in my office when I see a silver filling that they need to remove that unless there's a problem with it. Okay? Or unless they desire to have it taken out. There are patients who's nervous about that.
Right.
And I would be happy to do that. But in my opinion, and there's varying opinions on that, obviously, my opinion, I think if you're not having a specific illness or problem with some toxicity, and you can have blood work done to check that, my recommendation is to leave it alone. I think you can actually cause more damage if it's not removed very carefully, because you can create filings that can be more hazardous to you if you swallow that and that type of thing. Does that answer your question?
Yes, thank you very much.
Okay. Thank you.
You know, that's a, you know, I guess the old fillings were made of mercury, or
They contain some mercury in them.
and now what are they making them of now?
We have a composite material. It's actually called bis-GMA. I don't want to get too much chemistry,
yeah.
but it's basically a plastic material.
Good.
The advantage of this material is the fact that the expansion and contraction of this material is very close to that of tooth structure. And the problem with silver fillings particularly is the fact that that metal expands at a much greater rate and shrinks at a much greater rate than tooth structure. So consequently, very early, that filling is not sealed real well, and consequently, bacteria gets underneath it. It becomes very difficult radiographically to tell whether there is a cavity around some of these teeth because of that. So that's one issue. The other issue is it cracks tooth structure.
Okay.
That expansion and contraction with small amount of tooth remaining fractures the tooth as well. The other advantage of the fillings we use today, composite fillings, is the fact that that composite actually makes a bond to the tooth structure. And so consequently, you impart some strength back to the tooth. That silver filling is just something that fills that cavity that was there. And so it weakens the tooth tremendously. A composite imparts approximately about 70% of the strength back to the tooth.
Wow, that is great. So of course we want to not have those to begin with, not have cavities to begin with.
I haven't done silver fillings probably in 10 years.
Yeah. Now, one of the things that I know a lot of people have questions about, I do, is that, you know, when I go to the dentist, it makes me nervous. You know, how do you relax somebody? You know, there's lots of nerves in the teeth, and, you know, it's lots of nerves. How do you get them to sort of settle down so that they're not nervous and all that, whether you're doing anything? How do you do that?
It's a trust relationship.
Okay.
Okay. And so I feel like not every dentist is for every patient. Okay. If that patient has truly have to start learning to trust, okay? And that's a difficult process. I try to put my patients, me in my patient's shoes, okay? When I imagine me sitting there, what would I want to know? What would I want to experience at this point in time? And so over the years, I've tried to perfect given injections. I think that's made a huge difference in the patients, and I have many patients that comment about the gentleness that we do, and I'm not saying I'm so special about doing that, but that's one thing I've really focused on, trying to make that experience, leaving the topical anesthetic a little bit longer. And once you give them an injection and they really didn't feel that much, there's a huge trust that's already built there. They feel like you truly care about them. And so sometimes sitting down and making some small talk helps a lot by just relaxing them and making them feel that you really care about them.
You know, you hear so much on the radio, you hear about sedation dentistry and give you that and give you that.
Sure. I mean, and that is a method to do that. I've just chosen in my practice not to do that because I would like to have, I don't want a practice full of extremely afraid patients. I want patients who really trust me and are comfortable with what I do.
Well, I agree with that because, you know, the more medicines you put in a person, the more risk you have. And I found that similarly when I do a procedure on a patient. If you do the numbing correctly and get them to relax, then you're not going to need a lot of other things that can mess up the procedures. We have a question that's come in, and this question is, are root canals dangerous to our health? So I think first we need to talk about what is a root canal.
Okay, a root canal is basically when the nerve inside the tooth dies, there's no more blood supply. And so consequently, it's a void inside the tooth that bacteria can multiply. Okay. And so the body tries to protect itself from that bacteria, and it forms what's called an abscess, tissue that they lay down around the end of the root of the tooth to protect itself. Okay. So root canal, basically what we do is we go in the inside of the tooth, make an opening on the top of the tooth to get access to the nerve chamber. Once we get in the nerve chamber, we can clean that out with mechanical instruments, little files, and then also we can use some chemical agents to help kill some of the bacteria in there. And once that is cleansed, we fill that space with a filling material. It's called gutta percha. Many years back, they used silver points, but today we use a plasticized material that forms a hermetic seal at the end of the root of the tooth. Okay. Completely seals it so that now bacteria that's remaining around the end of the root has a blood supply, and the body can send its soldiers and clean out the bacteria there and solve the problem. Okay? So that's a root canal. So is it dangerous to our health? Well, obviously, if the root canal is done correctly, I don't think there's a problem. Okay? I think there's many root canals that's being done every day, and we're able to save teeth through doing root canals, okay, that would have been lost otherwise. I think if, obviously, if you're doing the root canal and you exit the end of the root of the tooth and you're not careful about doing that, you can push a bunch of that filling material out into the soft tissue surrounding it. And I don't think that's dangerous, but I guess if enough of that gets in there, it can cause a problem, yes. So I don't think from a standpoint that root canals are dangerous to people's health. It can cause additional problems if it's not done correctly.
Yeah. And you know, from my standpoint, I think it's probably more dangerous if they don't have it fixed and have a chronic infection.
Correct.
Give us a call. We're talking with dental professional Dr. Nick Van Zyl. We're 855-644-3278. You're watching Heart of Health Live, and we're going to take your questions after this short break, so stay with us.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum with your medical moment. I don't know about you, but I get thirsty if I talk a lot. Well, one of the greatest needs of our body is water. Did you realize that up to 70% of our body is water? All the chemical reactions from the brain to the heart beating to the muscles moving all depend on water. It's one of the most important substances we put in our body. If we get dehydrated, many bad things happen. We can have inflammation, we can have the blood thicken, we can have blood pressure changes, we can even have our heart race. You don't want to be walking around in the desert. Hydrate yourself. How much do you need? Divide your weight in two, that's about how many ounces. Or drink enough water till your urine comes out clean. Remember, water is one of the most important ingredients we put in ourselves every day.
To learn more about your health and discover what Dr. Marcum is doing in your area, visit heartwiseministries.org.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health Live. I'm Dr. James Markham. We're here with Dr. Nick Van Zyl, and we're answering your questions about all sorts of things. We've talked a little bit about TMJ. We've talked a little about root canals. And now, Joanne, you're with us with Dr. Van Zyl. Go ahead, and what's your question?
Yes, I have arthritis all over, and I've had a knee replacement, and I have fibromyalgia. And I was wanting to know, and I do a lot of walking, I was wanting to know, is there something else I could be doing to keep it from being so bad?
Okay, Joanne, we're going to talk that in relationships to fibromyalgia and dental problems. Go ahead, Dr. Van Zyl.
There are some patients that we've treated for TMJ problems who also have had fibromyalgia.
I can't hear you.
Okay.
I'll say that again. We've had some patients that we have treated for TMJ problems who also have had a diagnosis of fibromyalgia. And once we have helped the musculature relax, I don't know if you see the segment before this where we talked a little bit about the musculature and how we relax the musculature, some of their fibromyalgia symptoms have become, some have been eliminated and some have gotten much better. So I don't think there's a connection between it, but I think there's a possibility that some of the symptoms that you have can be relieved if you have issues with TMJ problems. If you've had headaches, neck pain, numbness in your hands, ringing in your ears or congestion in your ears, all those are classic TMJ symptoms that patients will have. So there could be a connection. I don't think it's documented really well, but I have seen several patients that we treated. There's a website you can go to. One of my friends out in Kansas City, Dr. Raman Prabhu, has got a website where he has documented some patients. He has some videos of patients that he's treated that have had fibromyalgia and their symptoms have disappeared. His website is midwestheadaches.com, and you're welcome to go look at those. And there could be a connection. There could be something that could help you in that regard.
Yeah. And Joanne, there's other things that help fibromyalgia too, and we get that question a lot. And you know, if you think about it, you know, TMJ puts a lot of stress on muscles, and anytime any part of the body's stressed, the body makes chemicals from the stress part of the brain, adrenaline and cortisol, which makes more muscles stressed. Right. Also, a lot of people have changed their diet quite a bit just in case there's something in the diet that might be triggering the body to attack itself. I've had people that start exercise programs, that drink water. All those things also might help. So we will be praying for you, and you might want to check out that website. Okay, Joanne?
Okay.
Okay.
Thank you so much.
Thanks
you
for
have
the call.
a blessed day.
Okay. You know, Dr. Van Zyl, a lot of people do have fibromyalgia. A lot of people have stuff that we can't really explain sometimes. Sure. And if we can just make one system a little bit better, sometimes that takes stress off everything else and turns down those chemistries. I've got a couple that have come into our website. And if you want to get a hold of us on our website, it's heartwiseministries.org. Or you can be one of our Facebook friends. That's growing every day. You know, Facebook, if you want to keep track of what we're doing, the guests each week, you can be one of our Facebook friends. And this question is from a concerned mother. And she asked, how old should a child be before their teeth should be checked? You know, the teeth don't come in for a while, so I guess you wouldn't have to check it for a while, would you?
Yeah. We recommend in our office, you know, and we see a limited number of pediatric patients. Okay. We see a lot of adult patients, but we recommend around age 3 to 4 years of age. We recommend that parents bring their kids in, and what we do in our office is we allow them to bring the kids with when they have their teeth cleaned to just kind of get accommodated and get acclimated to the office a little bit about things that are going on in the office to get them more relaxed, those kind of things. But yeah, around 3 to 4 years of age, I think is appropriate time to start having some dental checkups.
Well, let's talk about maintenance. What should everybody do with maintenance for the teeth? You know, we'd say you should get a physical every year and you should get your blood pressure checked at this age. Well, what should average people do that don't have really any problems with their teeth? What should they do on a regular basis?
You need to go see your dentist.
How often? You know, once a year? You know, is it just for
that varies from patient to patient.
Okay.
Okay. Traditionally, what we're doing is we're seeing patients twice a year.
Okay, twice
But the reason we see them twice a year is because dental insurance pays for them twice a year.
Okay.
There are patients who would benefit from being seen 6 times a year.
Okay. Okay.
And then there's patients who might only have to come once every 2 years.
Mm-hmm.
Okay. But traditionally, we see patients every 6 months. And the reason you need to go and see your dentist is we all have minerals in our saliva. Those minerals varies from patient to patient, the amount of minerals that's produced. Those minerals are excreted and will start calcifying the soft plaque on your teeth if it's not removed effectively.
Okay.
And so even if you remove plaque, that hard deposit called calculus will attach to teeth.
Okay.
They've done studies on rats. Sterile lab rats still produce calculus. Not just have to have bacteria in your mouth. It is the minerals in the saliva that will cause that hard deposit to form. Those hard deposits, you were giving us statistics, 75% of adults in the United States have some form of periodontal condition. That hard deposit on the tooth causes an immune response, okay? If you take your hand and scratch it, the first thing that happens, it gets red. The reason it gets red is the body says, hey, what's going on there? There's increased blood flow. The body is sending soldiers to that area to say, what is going on here? The same thing happens when you have that hard deposit forming on the tooth. The gums swell. You might see bleeding when you floss or brush. All those things are indications that there's an immune response to it. I'm going to simplify the process, but basically what the body does, when there is bacteria that is calcified into that hard tartar or calculus on the tooth structure, they bring buckets of acid called myeloperoxidase, and they pour that on the bacteria. Now, what elicited that response was not a live bacteria, but it could be a dead bacterium as well. It's a product in their cell wall called endotoxin that actually elicits that immune response. So whether it's alive or dead, it really doesn't matter. The immune system attacks it. And so if that hard deposit stays on the tooth structure, what ends up happening is that acid that's poured onto the bacteria to kill the bacteria also starts dissolving the bone that surrounds the tooth. So the loss of bone around those teeth, which is called periodontal disease, happens because of our own immune system trying to protect us from this bacteria. So if that hard deposit is not removed from the tooth, and you're not able to do it with your toothbrush, you need a hygienist to use some sharp instruments to scrape that off. It becomes hard as bone. Over time, your teeth will become loose. The problem is that process is a painless process. There are some signs, bleeding gums, swollen gums, those kind of things. And then eventually your teeth will become loose and you will lose your teeth because of it.
Well, you have convinced me because I don't want that to happen to me and I don't want that to happen to you. Now, we're very concerned about it because a lot of my patients have metallic heart valves. And we know that there's any infection anywhere that has access to the bloodstream that can have access to the bloodstream. We don't want it to get it near a heart valve or anything that bad. So that's great advice, getting it checked about twice a year. We're going to come back to our phone callers after this short break. We have Constantine. We're going to get back to your call, so don't go away. You're watching Heart of Health Live. Our phone number, 855-644-3278. We're on with Dr. Nick Van Zyl. He owns a practice in the Chattanooga area. We're going to give more information on that as we go. Stay with us. If you have a break, might be a time to go brush your teeth or floss. We're going to be right back. Stay with us on Heart of Health Live.
The Heart of Health Live will return in just a moment.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Hello, I'm Dr. Tim Jennings with your Mental Health Minute. Science has now shown that exercise is not only beneficial to your body, but keeps your brain healthy as well, decreasing your risk of dementia. When we exercise, the muscles produce a powerful anti-inflammatory factor which reduces inflammation throughout the body. Exercise stimulates the brain to produce chemicals that elevate mood and contribute to the infamous runner's high. But more importantly, exercise triggers the brain to produce proteins which cause the brain to make new neurons. In a recent study of 120 older adults, aerobic exercise caused the portion of the brain critical to memory to grow by 2%. This growth effectively reversed brain volume loss which occurs with aging. The multiple beneficial effects of exercise not only promote better physical health, but keep your brain young, reducing the risk of dementia. To be smart requires a healthy brain, so be smart, train for your brain.
To learn more about mental health, visit comeandreason.com.
Hi, I'm Dr. James Markham, speaker, director of HeartWise Ministries. And at HeartWise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the HeartWise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Dr. Nick Van Zyl is answering your questions. We're going to right to the phone line. And Constantine, you're on with Dr. Van Zyl. Go ahead with your question. Constantine, are you there? Hello, hello, Constantine. Am I close to getting the name right?
How you doing? Good afternoon.
Constantine, are you there? You're on
Yeah, can you hear me? Good
Yes,
afternoon.
go ahead with your question. We hear you just fine. Go ahead.
Okay, my question is, if you have a missing tooth, right, and you got to drill the gum to put a teeth in it, how dangerous is it?
Say that again, Constantine. I missed part of that question you asked.
Hello?
Can you say your question again, Constantine? Go ahead. Missing tooth, we heard that
if you have a missing tooth, right,
Yeah,
and you got to drill the gum to replant a teeth in the gum, how dangerous is it?
How dangerous to put a tooth back in that has come out? Is that the question? It's
Yes,
not.
ma'am. Yes, sir.
As long as if there was an injury and the tooth was knocked out, as long as you don't touch the end of the root of the tooth, actually what they recommend you do is put that tooth in a cup of milk or something, and go to the dentist, and they can take that tooth, if the root has not been touched, and they can actually put it back in the socket, and there's a pretty good success rate on that tooth reattaching in that position. Sometimes we have to splint it with a wire or something like that, but it's not dangerous. If there has been enough damage there, it will just not reattach, and the tooth will come out anyway. So no danger involved with that.
Yeah.
Does that answer your question?
I talking about when the gum already healed.
Oh, when the gum already heals? I don't think it will reattach in that situation. There are things that we do today called dental implants, where we can physically put a fake root in the tooth, and those work very well. But a natural tooth, once the gum is healed up, I don't think that's something that would work from what I know.
Ooh.
Okay.
Okay, thank you, Constantine.
Thank you for your call. Melissa, you're on with Dr. Van Zyl. Go ahead, Melissa.
Okay, thank you.
Melissa. Melissa, we hear you. We know you're out there. Melissa.
Well, you know what? I cannot hear you.
Well, can you hear? Go ahead with your question, Melissa.
Can you hear me?
Yes, go ahead.
Okay, I cannot hear you. You're kind of fuzzy on the phone,
Well,
so I'm sorry.
Just go ahead and answer.
I'll just pretend like I'm talking to somebody.
There you go.
Some time ago in the 1990s, I had a lower jaw wisdom tooth removed that was growing under the gums towards the, heading towards the front, towards my other teeth. And my dentist had to cut the wisdom tooth and try to finagle the roots from the nerves because they were intertwined with one another. And, oh, yeah, it hurt a lot because he kept injecting and injecting and injecting with numbing, and it didn't work. But it didn't bother me for quite a while after even having a dry socket. It healed up fine. But within the last few years, I guess maybe 2 or 3, I can't remember, one to 3, I had a panorama x-ray done and at the dentist, and the dentist seemed a little concerned with that area. He's not really sure if it's scar tissue or if it's something else, and he advised me to go to an oral surgeon. I went to an oral surgeon, and he looked at the panorama, and he said if I could get a hold of the previous x-rays of, not too long after that was removed. So I did, but I have not gone back. Shame on me, I know, but I'm a procrastinator at times. But I just thought I'd call in to see what other things it might be. And I'm going to hang up so I can hear you on the TV, okay?
Okay.
Thanks.
All right.
You know, that's really difficult for me to say without seeing an x-ray, okay? But the dentist is correct. It could be scar tissue if there's a lesion there. Usually it will be a white lesion, okay? Dark lesions on an x-ray really shows loss of bone in that area, and that can be related to an infection. But if you're not having any symptoms, we don't treat x-rays. We treat people.
There you go.
And so if there's no swelling and there's no symptoms related to that, I wouldn't be too concerned about that.
Yeah, I agree.
That's what I would say.
I agree, because sometimes we do too much.
We see things and we're trying to fix something that's really not broken.
Right.
Okay? And so unless there's a symptom you're having, swelling, pain, that kind of stuff, I wouldn't be too concerned about that.
Good. Okay. And I'm sorry we couldn't hear you. You couldn't hear us very well. We heard you just great. Susan, you're on with Dr. Van Zyl. Go ahead, Susan.
Hi, thank you for taking my call.
Go ahead.
I was hoping to have, since we have a dentist and a doctor together, I would love to hear you speak to the new trend we're seeing in anxiety-free dentistry and what that can mean to the patient and how it can affect the body, the heart, the physical, as well as the dental.
Anxiety-free dentistry. We talked a little bit about that before.
We did.
I think having a good trust relationship with your patient. I think what she's talking about is some new trend in dentistry where we're using some medicines to relax patients and to get them more comfortable to do dental procedures.
Right.
But I think there, even though there's great caretaking with that, still you're putting drugs in a person's system, and that's never a good thing. In my opinion, the least medications we're on, the better off we are. And so I think obviously if a patient is very nervous, your body is producing a drug,
right?
Norepinephrine, epinephrine that's produced during extreme anxieties, okay? And so I think it's important for you to go to some place where you feel a good trust relationship, where you really trust somebody is not there to hurt you, is there to help you. And that can be difficult. So there are patients who are extremely nervous and afraid. I feel the place to treat those patients, in my own opinion, is probably in a setting where they're completely under the care of anesthesiologists, okay, and have their care done under that. But I feel like a good trust relationship with a patient we can have, I've had patients who were so nervous they wanted to jump up and run away. And some appointments we sat there and just talked for 20, 30 minutes.
Yeah.
And those patients today are patients who have almost no fear for any treatment that we do on them. So I think it can be overcome, but it takes, you need to find a special dentist who will be caring enough and that you can create a good relationship with it. And I think that can help it.
You know, and Susan, you know, the fear and all that comes from a part of the brain called the amygdala, the stress part of the brain. And just sometimes when the front part of the brain, like he says, when you can turn on the chemistry that knows that everything's going to be okay, we can take some deep breaths, we're going to numb it up well. That's always our best first option to relax rather than to take the medicines. But some people sometimes need it, but we don't want people to have stress. That's never good either. So I hope that answers your questions, and thank you for your call, Susan.
That was a great answer. Thank you both for speaking.
Well, we got to go to break now. You're talking with Dr. Nick Van Zyl. Our phone number 855-644-3278. We don't have much time left, but we're going to get to as many questions as we can in our last segment. So stay with us.
The Heart of Health Live will return in just a moment.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Medicines That Kill from cardiologist Dr. James Markham is now available. In his newest book, Dr. Markham explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said, or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program, but we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the tree of life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Joseph, we're glad to take your call. You're talking with Dr. Nick Van Zyl. Go ahead with your question, Joseph. Joseph, it's your turn. Come on, Joseph. We're waiting for you. Going once.
Yeah, how you doing?
Oh, go ahead, Joseph. You're on with Dr. Van Zyl. Joseph,
okay, I have a what's called an inguinal hernia. It's in the groin, and what? Could you hear me?
Yes, go ahead, Joseph.
Okay, I've had a little problem, but I'll take your answer. I have an inguinal. Okay, I have a hernia, an inguinal hernia.
Yeah.
It's in the groin and went right into the scrotum.
Uh-huh.
So now I guess they can't hear me.
Yeah, we hear you. Go ahead, Joseph. Keep talking.
Okay, it's an inguinal hernia in the groin and it went right into the scrotum.
Uh-huh.
And now I've seen some videos on it. Do they actually cut out the hernia or they push it back in only?
Okay. Well, I'm going to handle this one, okay? You know, usually an inguinal hernia is a weak spot in the connective tissue in that part of your body.
Yeah.
If it's pooching out, what you need to do is see a good surgeon, and he will actually put the part that's pooching out back in, and they usually put a mesh to keep it where it belongs. So you really need
the mesh on the video.
Yeah, you need to really go see.
But I mean, I've seen some of the videos. They cut something out, or
no? What they usually do is they put a little space where they put the mesh in, and then they usually sew the mesh in so it keeps that part of the body where it needs to. And unfortunately, sometimes if it's on one side, there's a higher chance of it going to the other side.
I see.
Okay.
But they push everything back. They take it out of the scrotum and push it right back in.
They push it back in, and then they put some mesh. But thanks for the call, Joseph. Okay. Actually, we're talking about teeth today, so that really broke up the discussion some. Thanks for calling, Joseph. Okay, we have a question from Ruby. It says Ruby has a TMJ problem. She has a special metal insert in the bottom teeth with lots of problems with the metal insert. Any advice?
I'm going to make an assumption that the metal insert is a dental implant. And those could or they could not be related. If there's a problem with the metal insert or the dental implant itself, it is unlikely that would be causing some of the TMJ problems that she's having. Although if she's missing a lot of teeth, the musculature has to work overtime to posture that jaw. There's not support from the posterior teeth. A lot of times people will lose posterior teeth first. They'll have some anterior teeth. And if that implant is there to help support the posterior teeth and she has a problem with that, she might be transferring some of the forces over to the one side, and that can cause some TMJ issues over time.
Okay. Steve, we got about 30 seconds. You're on with Dr. Nick Van Zyl. Go ahead. Got to make it quick. Steve?
Okay, Dr. Van Zyl, what about receding gums? What is the cause of them, and what can be done to cure them?
Okay. Well, Steve, I'm sorry. We're out of time, but we're going to get that later. We talked about receding gums. Any quick advice about receding gums?
Can be related either to gum disease or it can be related to parafunctional habits, grinding and clenching of your teeth.
Okay, well that was a great question, Steve. Sorry, we're just all out of time. And if you want to ask more questions, go to our website, heartwiseministries.org. I will collect the questions and we'll ask Dr. Van Zyl to come back another time. We want to thank you for joining us today on Heart of Health Live. And remember, there's a place for modern medicine. There's a place for lifestyle, but it's that unique relationship that we have with God that brings us ultimate healing. Thanks for joining us, and we want to also thank Dr. Nick Van Zyl for giving his time tonight to join us and help serve the world by explaining all these things about dentistry. Thanks for joining us.